Does growing older mean that we inevitably lose our quality of life? The answer is a resounding no, according to our guest today. I'm Grace Trafton of The Better Part. Stay tuned and find out how we can continue to be healthy and vibrant in our golden years.
Welcome to The Better Part, a program that encompasses a diverse spectrum of topics important to our community, which we hope will both inform and entertain you. We invite you to sit back and enjoy the program.
Donna Holt, our guest today, had been a cardiovascular nurse at Good Samaritan Hospital for almost 22 years before retiring in 2010. Currently, she's studying gerontology at Foothill College and doing volunteer work, including founding a quilt program at the Santa Clara Children's Shelter and being involved in health screenings, blood drives, and flu shot programs. Welcome, Donna. I'm so glad you could be with us today.
Well, thank you, Grace. It's nice to be here.
Having worked at Good Samaritan Hospital for over 20 years, what differences have you seen in the way the hospital functions today versus when you first started?
There have been many changes in the medical field. Surgery today is less invasive than it was 20 years ago, and there was a longer period of recovery for the patient at that time. Less invasive type of procedures like laparoscopic surgeries are done for appendectomies and for gallbladder surgeries. Patients, the diagnostic tools they have available are much more advanced. We have echocardiograms and stress tests that they do on patients for cardiac problems, whereas before we just had EKGs and cardiac caths were done, but those were done mainly as a diagnostic tool. Now they have cardiac interventions that can be done and stents can be placed, and so as a result there are fewer bypass surgeries for the patients. And that also lessens the amount of time that the patient will have in the hospital. There's also been an increase in the things that they have available today, like delivery systems for medication. Those are other things that are commonly used.
So there has been quite a few changes in the intervening years, it sounds like. And how has the role of the nurse changed?
The nurse has at her disposal more high-tech equipment, and she's no longer considered the handmaiden of the doctor. We're partners with the doctor, and so we are able to make critical care decisions with the doctor and be more efficient with our care. We're the eyes and the ears for the doctor, and many times we will see something that's happening to the patient before the doctor, and we'll be able to give some care right away that we weren't able to do in the past. And nurses are in the hospital setting, they still have the professionalism and care for the patients just as before, but you won't see them wearing a white uniform with a white hat.
No more, huh?
No, not anymore.
And have you also seen differences in the patient profiles?
We are all living longer, and that has to do with a lot of the medications. Patients that may have died in their 70s are now living into their 85, 90s because of the medication that's available. The patient population is a lot sicker that come to the hospital. They may have multiple chronic illnesses. They may have heart disease, diabetes, and cancer, and have very complex care that's required and require more IV therapy while they're in the hospital. And another thing too, the patients are having to get used to the fact that they have what's called a hospitalist in the hospital today, and that's a doctor that takes care of them only when they are in the hospital, and then when they get out of the hospital they will go back to their what's called their primary care doctor. So these are some other changes in the patient population that we have.
So, how can we be better partners with our doctors?
It's really important when we are going to see our doctor that we make a list beforehand of what we are going to see the doctor about. And also, it's vitally important for the doctor to have a list of our medications. We may think, oh, the doctor has all those medications in his computer, but you may have seen another doctor 2 weeks before. So it's really important to take a little time before you go to have things in order so that you can be a partner with the doctor. And that will make your outcome a lot better. Sometimes also taking a friend or a loved one with you that will be able to take notes, and also that loved one may be able to interject things that you might not have thought about to tell the doctor. And last but not least is before you leave the doctor's office, also make sure that if you have any questions that you ask the questions that you have.
I understand that the number one health problem in the U.S. is cardiovascular disease. Tell us about the risk factors and warning signs.
You're so right, Grace. The number one problem today is heart disease, and a lot of things are risk factors that are involved are high blood pressure, obesity, diabetes is another contributing factor, high cholesterol, physical inactivity, that is another problem. We also have smoking. Smoking, if you stop smoking, that is another thing that can be helping you to increase your lung capacity that will also avoid having a heart attack. Some factors we have no control over. We don't have control over our sex or our hereditary factors or our previous heart attack or stroke. Those things we have no control over, but there's a lot that we do have control over. And there has been some things that have been shown to help us avoid heart attacks, and that is having good dental care. People may not be aware that, our mouth is really important to have good dental hygiene on a regular basis and have good dental checkups. Another thing is they're finding that vitamin D levels, if they are too low, that they also can be a contributing factor to heart disease.
And these are things that we really didn't know about until recent years,
That's right?
Very recently.
That's right.
And you've already mentioned that one of the contributing factors of heart disease is high blood pressure. What can we do if it's too high?
Having high blood pressure can be controlled by diet and exercise. Those are some of the main things, and also some stress reduction activities in your life. Maybe going out for a brisk walk or taking some deep breaths. These are some things to help you with the stress part of it. And if those things do not work, the doctor will recommend you to stay on some medication. And the medication is to control your blood pressure. Optimally, the doctor would like your blood pressure to be 120/80, and so they've lowered those numbers in the past couple of years, and they find that if you have it controlled at that level, you'll have a better outcome. And the other thing, people sometimes they think, oh, I'm feeling better now, I can go off of this medication. Right. It's very important never ever to go off of any medication once the doctor has recommended it. And once you are on this medicine, to check your blood pressure regularly. Purchase a blood pressure machine. Mm-hmm. They're readily available at your pharmacies, and you can also get a prescription, I believe, to have a blood pressure machine.
And salt is one of the contributing factors to high blood pressure. And a lot of people think it's the salt shaker that's the culprit, but actually it's not. The primary problem is processed foods, which is often loaded with salts. And there's lots of hidden salt in some of the foods that we may not suspect. Where can we find some of the hidden salt?
No, I believe a lot of people want to stay healthy and avoid salt, but it is really hard, as you say, to avoid salt. You'll find it in yogurt and bread, but it's important if you do have hypertension or a heart condition to read the labels. Another name for salt is sodium, and so you'll commonly find sodium listed as one of the ingredients that's on a product, a food product, all the food products. But you'll find it also in hot dogs and ham and bacon and many of the, like you said, processed foods, cheese. These are just some of the things, and there are ways to find out also by maybe reading up on where salt is. It's also found in ketchup and things
Right.
like condiments that we put on
Right.
our foods. So we would like to try to avoid the salt, and when you go maybe to a restaurant, which a lot of people like to go out, is ask them to prepare the food without the salt. There's other herbs that you can use, and there's also other things that we can do to make our food just as tasty without the salt, and have a fruit or vegetable instead of some of the French fries and things like that that we like to put on our plate.
How about high cholesterol? We hear so much about saturated fat, trans fat, unsaturated fat, and also we hear about triglycerides too. So tell us about these issues.
Many people think that cholesterol is bad, but we need cholesterol. Cholesterol is in all of our cells of our body. It's just we do not need too much of it. We don't need too little of it either. So our optimum level of a total cholesterol should be 200
Or less.
or less. And if it is, the doctor will commonly put you on a statin drug or ask you to try to reduce that by diet or exercise. So those are the ways that we sometimes can reduce it. But it's also some of the dietary things that you were talking about is the saturated fats. Now, the saturated fats that you commonly hear people talk about are the animal protein, the milk, the dairy products. Those are very high in saturated fats. Then there are the trans fats. The trans fats are those that you find in your cookies and your French fries and donuts. These are also, we want to limit those. We can still have them, but not every day. Right. And the reason that we want to avoid high cholesterol is because the cholesterol sometimes will build up plaque in our arteries, and if that breaks off, that can cause a heart attack or a stroke as well. So we want to use more of the olive oils, the vegetable oils. Those are all good oils to incorporate into your diet. And that's a much better choice to make.
Now, type 2 diabetes is a fast-growing problem in our country. Before we discuss this problem, tell us the difference between type 1 and type 2 diabetes.
In type 1 diabetes, there's an absolute lack of insulin. So it's an insulin deficiency. And insulin compromises the body ability to utilize glucose. So if you can't use glucose, then you will also have other problems in your body. You'll have a high glucose. So a person with insulin deficiency or type 1 will need to have insulin on a daily basis, and they will have to monitor their blood sugar probably more than once a day, at least maybe 2 to 3 times a day in order to get good control. Now, a person with type 2 diabetes, they have also a limited amount of insulin that's being secreted by the pancreas, but they still have some insulin. So they need to have medication given to them. And the doctors today are having much tighter controls on people with the diabetes. They would like blood sugars to be no more than 100. So you'll commonly hear the term pre-diabetes, and these are people that need to be attentive to their diet, and they are not yet on medication, but they need to really work on keeping their diet under control. They also, the people that have type 2 diabetes, they can become type 1 diabetics sometimes, and they then will require insulin.
Oh, I see. Shots, you mean?
Insulin shots, yes.
Oh. So I understand that approximately 90 to 95% of people with diabetes have type 2. And that some of the risk factors for diabetes is having a parent or sibling with diabetes, which is something we can't really control. And some people have gestational diabetes, and having a baby weighing over 9 pounds, and having a low HDL, having a low good cholesterol, under 35. These are some of the risk factors, some of which, as I said, we can't really control, but others we can, such as the HDL. What are some of the other things we can do to prevent type 2 diabetes? You've already mentioned several factors.
Well, diet and exercise, again, are very critical to doing that. And having your blood sugar checked regularly, along with when you go for your annual physical, having that checked with your cholesterol. This is also very important. And people don't realize that stress also is another factor that is incorporated into having diabetes. Sometimes people, when they have extra stress, they'll eat more.
True.
So that is, and if they're at risk, then they will, push their blood sugar up.
Right. And so, we've been talking about healthy eating, and we know that we're supposed to be eating more grains and more fruits and vegetables, but how can we actually make the changes necessary for better health? We have lifelong habits, and they're really hard to break. We've started eating the way we're eating from the time we were toddlers, I think. And a healthy diet is not only important for physical health, but it also improves our odds of avoiding mental decline. So what can we do to change these lifelong habits?
Well, it's a daily process, and we have to decide that we're going to just take little steps at a time, because if we say, tomorrow I'm going to change my whole diet, I'm going to start exercising and going to the gym, that's just way over the top. So it's best to make small changes and do it, and that way and maybe even make a journal and say, okay, I'm going to write down what type of activity that I'm doing today, and maybe tomorrow I'll do a little bit more activity.
Actually, I think that's a really good suggestion,
Yeah.
because I've tried doing a food diary in the past, and I was shocked at how much food I was eating. It didn't really occur to me how much food I was putting into my mouth.
Yeah.
So keeping a journal, a food diary, is an excellent idea.
Yeah, and some people even go to the internet, because there are programs on the internet that will help you as well. So there's lots of different tools that we can make available to ourselves today to start small, and maybe decide to walk a little bit farther in the parking lot, or to take the stairs. If you're in a building that has stairs, take up to the second floor instead of, and get out of your cubicle at work and walk a little bit instead of sending that person an email or a text message.
Absolutely. Very good ideas. And so we've heard about the DASH diet and the Mediterranean diet. Can you just tell us a little bit more in detail what they are?
The DASH diet is a very sensible approach to eating healthy. It's an acronym for Dietary Approaches to Stop Hypertension. And it's been recommended by many doctors because it takes into account reducing salt in your diet, and it follows healthy eating principles for heart disease, stroke, and some cancer type prevention has been shown to be effective for this diet.
So, and what exactly is the Mediterranean diet?
The Mediterranean diet is very similar to the DASH diet. It also can reduce heart disease and cancer, and also there's been some studies that show it has reduced an incidence in Parkinson's disease and Alzheimer's. It is a diet that mainly focuses on eating lots of fruits and vegetables, a small amount of animal protein, more frequently fish and poultry, and also incorporating exercise and a glass of wine. But if you don't drink wine, we don't recommend that you start drinking wine now.
Oh, too bad.
But mostly it has more fruits and vegetables, and it's a very well balanced diet. And again, there's a lot of literature about this. It's a pyramid type diet, and it's very easy to understand.
One of the things we can do to start changing our lifelong eating habits is to just start by looking at labels, because you know, it's amazing what we can find out by looking at the food labels and also the ingredients list. And so you've been telling us about the importance of you know, healthy diet and exercise program, and stroke is the other major health hazard which is affected by our lifestyle. Tell us, what are the symptoms of stroke?
Stroke comes on very suddenly for people. Usually they'll notice a numbness or tingling in their hands or legs. It might be just one side of the body. There'll be a numbness in the face. There's also a sense of loss of balance. They will not be able to talk clearly, and their smile will be off. So if any of these happen, they need to call for 911 assistance immediately, because they have a 3-hour window of time when they can prevent having long-term consequences. Another name for stroke you may hear, it's called a brain attack. Just like they say heart attack, it's a brain attack. So it's very important not to delay, and don't try to drive yourself to the hospital. It's something that needs attention right away.
So you've already mentioned some of the things we can do to prevent strokes, but also smoking is a bad thing to do, right?
Yes, it is very.
And you've mentioned that we should, you know, engage in a healthy diet and exercise program. And I understand low vitamin D is also associated with greater risk of stroke.
Right.
Right? And heart disease.
Oh, yes, very much.
And high blood pressure, for that matter.
Right.
And more research is ongoing. And these are some of the things we really didn't know about before.
Oh, yes,
right? So
very
this is
much.
very recent. And you've talked about the importance of physical activity and how we can do more of it by maybe taking the stairs or parking farther away. Are there any other things that we can do as far as physical activity is concerned?
Well, one of the things that we can all do is, even if you're sitting in front of the television, is to march in place, move your legs, raise your arms up and down 10 times, and take some deep breaths. Deep breathing, believe it or not, really helps with your oxygenation level to your lungs and to your heart, and just remembering to do some things like that can be also very beneficial.
Now that we've covered the health issues we may face as we grow older, let's discuss what we can do to ensure that we're also going to grow better with age and experience positive aging. I know that a sense of purpose in life is really important, right?
Yeah, very much so. And, you know, a lot of people forget when they have retired to do some of these fun things. You know, pick an activity that you enjoy. Perhaps throwing a ball to your grandchildren. That's a good physical activity to do. Another thing is to maybe engage in some of the activities at the senior center. You were telling me about some of the things that they have at the Cupertino Senior Center. They have exercise classes to take. There's also other volunteer type of opportunities that are available in the community to make yourself more active. Also, you know, there's exercises, not necessarily an exercise, but playing bridge or mahjong with your friends. Those are all good mental exercises. And other things you can do is to just become more involved in your community and search out making new friends. Take a walk with some friends in your neighborhood. I started walking with a lady in my neighborhood recently, and it's really enhanced her life as well as mine. So taking part in those type of activities are really good.
Good idea, good idea. Now, I see that you've also brought some brochures and a book here. Tell us a little bit about what you brought us.
Well, some of these, I recently took a class and it was talking about living to be 100, and I brought that along, and there's talk about a lot of the different factors that we talked about today that enable people to live a long and healthy life. Also, there's a CD that is available. It's called Go for Life, and that is has some exercises that everybody can do.
Great.
That's on there that you can get free, and we'll have that information available for you at the end of the program. There's also brochures that you can get from your doctor's office or from the American Heart Association on understanding different things to do to be more healthy.
Great, good. Well, you've certainly given us lots of useful information to think about. So thank you so much for being with us today. I've really enjoyed talking with you.
Well, thank you very much, Grace. It's been a pleasure to be here.
I hope you found our program informative today. Thank you for watching, and tune in again next week to The Better Part.